afternoon in Australia and good morning in India and wherever else you are, the time of day. Thank you for joining this webinar, the next in our series of coronavirus briefings that NCR has been doing now since April of last year. It's hard to believe that a year has almost gone by, and here we are. But today with a very topical study that colleagues at the Nossal Institute of Global Health at the University of Melbourne and NCAER, the National Council of Applied Economic Research, have been carrying out in response to the coronavirus pandemic. This is part of a larger study of health-seeking behavior in 4 Indian states. But very soon after the pandemic started, the Nossal and NCR teams pivoted to a telephone survey. And we are today going to see the results from part 2 of this study. And it's a great pleasure to have colleagues from the Nossal Institute in Melbourne, as well as from NCER. Representing NCR will be Prabir Kumar Ghosh, fellow at NCR and the key lead for this study, and representing the Nossal Institute and our collaborators, Barbara McPake, Ajay Mahal, and Sumit Kane. And we are delighted to have our guests from Australia, and to all our attendees who are joining us, welcome, and we are delighted to have you with us. Without further ado, let me turn over then to Ghosh for starting the presentation, unless Barbara or Ajay, you want to say a few words right at the very beginning. Barbara?
I'll pass to Ajay, who I think is going to do the main presentation, and I'm sure we will.
All right. Okay, Ajay.
Thank you very much for inviting us today. We're delighted to be here.
Well, let me start by acknowledging first of all, the amazing contributions of the team on behalf of which I will be going through this presentation. And that's Prabir Ghosh from NCAER, Sumit Kane, Barbara McPake, and of course, a whole team of, I think, young guns at NCER as well. So I think it's not really, although I'm presenting it, it's really I'm presenting on behalf of a team, which is an amazing work over the last 8 to 10 months. So the results I'm going to talk about today are from the second round of the telephone survey that Shekhar spoke about. This survey was carried out in October last year and essentially continued the one from the previous survey in the round 1, which was undertaken in June. And the questions asked in this survey focused on the economic circumstances of households and on access to healthcare and schooling, including, of course, the role of government assistance in this endeavor. The sorts of questions we asked in this telephone survey, of course, linking to the broader objectives, fall into 3 main areas: on COVID and the economic condition of households, on access to healthcare services, and on effects on schooling among children, including participation linked to online education. The sample that we had for this survey was, in the second round, was 1,989 households, of which 65%, or 1,340 households, were from the first round. Effectively, we had a 35% attrition rate, which I believe is quite good for surveys of this type. We were also lucky in the fact that we could build off of a survey conducted in 2019, I suppose, pre-COVID. So we could actually compare the circumstances in these longitudinal survey with both pre and post-COVID situations. As you can see, the first round was conducted from June 9 to 18th, very soon after the lockdown was completed. And the second round was conducted in October 7 to 21, 2020, so somewhat later. As the slide shows, and is, as you know, Shekhar noted last time in the previous presentation, some months back, that in telephone surveys, it's typically very hard to carry out long interviews. So the typical interview length is about 15 minutes. So we couldn't ask all the questions that we wanted to, just the bare minimum. But we had the advantage of the NCR team being able to follow up through a variety of communications in case there were any sort of doubts, confusions in terms of responses that were initially gathered through the telephone survey. Again, it's worth emphasizing that of the original sample in the first round, that is in June 2020, of 2,068 households, we were able to sample 1,340 households. And these are actually the households that were also directly able to be reached by telephone. Then team could not reach the remaining 35%, presumably because they didn't even pick up their phone or their phone numbers had changed and so forth. I understand that's quite common, so people change their SIM cards and so forth. That's basically by way of background. The results that I will talk about today are specifically for the panel set in the household. So they are not a repeated cross-section, but they refer to the results from the 1,340 households that were sampled both in June as well as in October. It's the same set of households. By way of some sample characteristics, as you can see in both rounds 1 and 2, the rural households are roughly similar, about 3/4 of the sample. The average age of respondent is also pretty similar, as also was the gender of the respondent and household size. And if you look carefully further down, then you can also see that even the educational attainment of the respondents was broadly similar. So in some sense, in every which way, I think these are comparable. Of course, they should be comparable. It's the panel survey, but also the respondent may not have been very different from the first one. We didn't check, of course, whether it was the same respondent or somebody else. So let me focus on the main findings. And again, as I mentioned earlier, the 3 main categories of findings: economics in income effects, effects on access to healthcare, and effects on access to education. So the first set of findings are basically about what households were doing in terms of their main source of income. And it's quite remarkable if you look at these 2 sets of bar charts, one for Uttar Pradesh and one for Odisha. And what we have, each bar chart refers to a particular round. So the first bar chart for UP, for example, refers to the situation, the distribution of households by main source of income in the pre-COVID era. That is the survey that was done before COVID. The second one refers to the June survey, and the third one for the same set of households for the October survey. And perhaps the most striking finding is that if you look at occupations, literally the main source of income, the households have some occupation in both the pre-COVID round as well as in the second round. But in the middle round, that is immediately after the lockdown, you can see that a fairly significant proportion of households had no source of income. So in UP, in round 1, almost 31% of households did not have a source of income in June of 2020. In Odisha, the number was 27%. But by the time the second round came around, almost every household was able to report some source of income in terms of an occupation. Whether it's high paying or low paying, besides the matter, and we'll see some of that a little bit later. But they were involved either in self-employment in agricultural activities, in non-agriculture activities, casual wage work, salaried workers, and others, which is a relatively small category. So again, the key thing to note from this particular slide is that the share of households that were reporting no access to any income dropped dramatically by October. it might also be worth asking, among those households that did return to work, from those who had no income in the first round, that is in June 2020, what did they actually end up doing? And if you look at this chart here, you can literally see a decline in every category except one. And that category is self-employment in agriculture. That's the one that saw a large increase in UP and Odisha, but even more so in Odisha by almost 28 percentage points. So in terms of a share of what people were doing in October, a larger portion had moved from, well, whatever doing, from no work to working a lot in self-employment, perhaps in the family farm and so forth. Every other category compared to the pre-COVID period had a decline in share. Now, we'll have time to discuss why this may have happened, but for the moment, I'll leave it at that. We also looked at whether it mattered where a household was located in terms of reported income declines. And what we find that in Odisha, at least, it didn't matter whether you were living in a rural area or an urban area. Both sets of households, 80% typically, reported a decline in their income in both rounds 1 and 2 compared to the pre-COVID period. So everything is in comparison to the pre-COVID period. But in UP, on the other hand, yes, the declines are still quite high, but households reported a somewhat worsening, at least in terms of proportion of households reporting a decline in income in the second round compared to the first. Either way, I think the main take-home message is that a large proportion of households reported income declines, even in the second round. And that's interesting because, as you will recall from the first two slides, what we see is households moving back to some activity. But obviously, this increase, going back to the activity, whatever it is they were doing, was not sufficient for households to report having recouped their entire income loss that they may have incurred as of round 1. So, digging a little bit deeper into this, we asked what sorts of households reported income declines and which ones were particularly badly affected. And looking at this chart, and this again, if you look in the x-axis basically describes households by main source of income in the pre-COVID period. So these are households who said in the pre-COVID survey, this is before rounds 1 and 2. So there's a round 0, basically what I'm talking about here, that there were households that were reporting as their main source of income in round 0, if you will, self-employment from agriculture, self-employment from non-agriculture activities, casual wage work, salaried work, which could be both in the formal or the informal sector. We didn't clarify that. And the other category, which I said is quite small. And so what we see here is that if you look at these households, those households that were most reliant on self-employment in non-agricultural activities and casual wage work were the ones most likely to report a decline in income in the post-COVID rounds 1 or 2. Compared to that, the salaried group was somewhat smaller, and in Odisha, it was less so than in UP. In UP, even the salaried groups, a fairly large proportion of them reported declines in incomes. And you can see in Odisha, on the other hand, the self-employment group in agriculture reported larger declines and so forth. So again, these declines occurred across the board, but somewhat higher in the non-agricultural households depending on self-employment in non-agriculture and households depending on casual wage work. We also explored households' assessment about person's intensity of their income loss. And what we see here again, so the 4 categories of questions, 4 categories we asked households to respond to when being asked about declines in income, no decline, a less than 25% decline, a 26 to 50% decline, and 51 to 70% decline, of course, compared to the pre-COVID situation. And again, what you see here is, if you compare round 1 and round 2, and this is a slide specifically for the state of Uttar Pradesh, looking at the purple the color, what we see is across almost all income categories, occupational categories, we see a decline in households reporting income losses of between 51 to 75%. In other words, we see a moderating of the severity of income losses between rounds 1 and 2. That doesn't mean there weren't any income losses. We've already seen that there were income losses reported even in round 2, but a moderation of those income losses is the key message here. And you can see it across the board, that being true. If you look at Odisha, a roughly similar picture also emerges. There too, you can see that in round 1, fairly large proportions of households, irrespective of the occupational category, reported losses in income ranging between 51 to 75% compared to the pre-COVID period. And again, I must emphasize, these occupational categories are with reference to households that reported these as the main source of income in the pre-COVID era. So we can see again, because the purple block is falling between rounds 1 and 2 for Odisha, again, relatively speaking, the proportion of households reporting severe income losses, severe being defined here as between 51% to 75%, saw a decline. And on the other hand, households reporting no decline, except for the self-employment agriculture category, saw either no change or a significant increase in the case, well, actually no, it's roughly no change at all in the, I think in the salaried category, salaried category. Sorry, I take it back. I've got this messed up a little bit. So no declines, roughly, I think it's similar across occupational groups. I think, in fact, yeah, so the only, again, to summarize again, the main difference here is households reporting a decline of the severe kind. I think that's the key message here as well. If households are experiencing significant declines in income, although some moderation between rounds 1 and 2, what else happened in terms of, how are households coping, for example, with these income losses? So in this slide, what I have here are different ways in which households contended with a scenario of income losses. And so what we have is for both UP and Odisha, and for both rounds 1 and 2, different types of coping strategies that that we asked about and that they responded to. So one thing that we can see, that irrespective of the round, drawing down of savings was a major source of compensating for income losses for households in both UP and Odisha. Borrowing was important as well, but what we see here is a somewhat interesting finding that in UP, households reported a slight decline in relying on borrowed money, whereas Odisha reported a slight increase, well, a doubling almost of the share of households reporting borrowing. Now, whether this reflects exhaustion of borrowing opportunities in UP and people in Odisha relying on opportunities for borrowing is a different matter and requires further investigation, but it's a pretty striking finding. The other striking finding that we had in our survey was the significantly large proportion of households receiving assistance from the governments. And you can see almost 4/5 of the households in the sample reported receiving assistance in UP, whereas almost 87% of households in Odisha, again, a substantial increase over the first round, also reported receiving assistance. So that's Again, whether that reflects households reaching out for support as they become more desperate, or whether the government program has expanded is less clear, but all in all, it does suggest that government programs were reaching households at that point in time. The other, I think the other interesting category is the last one, where we see that reflecting perhaps the improved situation in UP, households relying less on reduction of food expenditure in UP, but relying somewhat more on food expenditure in Odisha. So again, that may reflect perhaps households need not be entirely being met by the government assistance in Odisha, but again, it's hard to say without further investigation. Nonetheless, when these are certainly, we can observe some changes in household strategies to cope with income losses in these two survey rounds. We also asked whether the patterns of borrowing to compensate. So this is not really debt. It's the same question on borrowing from the last slide. We also asked whether there were differences across occupational categories in propensity to borrow to meet financial requirements of households. And not surprisingly here, we see that at least in that casual wage work is the dominant category in terms of relying on borrowing to meet their economic needs in both Odisha and in UP, and that's in Odisha, of course, it's seen a dramatic increase, and perhaps that's been the major driver, along with self-employment, non-agriculture, major driver in Odisha of increased reliance on borrowing. Beyond that, we can see that clearly that in UP, the greater reliance on borrowing, Odisha somewhat less, and I think those need to be investigated a bit further. But if we had to have one takeaway from this slide, it is that casual wage work, households relying on casual wage work income are the ones most challenged by the economic requirements of the epidemic. And they're, of course, the most, in some sense, often the most vulnerable of the working categories. This slide sort of is not so much about income losses or about effects on health and education, but we thought it might be interesting to see whether, in fact, there were shortages of essential commodities that households had to contend with in Odisha and UP. And the main sort of, households do report shortages, certainly in both states. What we see certainly is an improvement of the circumstances in UP. We can certainly see across the board the proportion of households reporting shortages of any of these items, whether food or non-food cooking, medicines, fuel, and so on, literally going quite decline throughout. And that's, again, sort of may very well reflect improved government assistance also observed in UP in a fairly sharp increase in over rounds 1 and 2. In Odisha, on the other hand, we have sort of a mixed bag of results. Some things became more difficult to obtain, mainly food items, by a few percentage points. On the other hand, others became relatively more available, cooking fuel, medicines, and so on. So again, it's worth investigating why this may have happened, but this is what we see in our data, that generally speaking, shortages declined in UP, in Odisha, mixed bag, food item shortages increased, whereas non-food items, at least the ones that we have in this survey, saw a decline in terms of proportion of households reporting shortages. Of course, we concluded this particular part of the questionnaire by asking what households' perceptions were about their future economic/financial situation. And personally, I think these are quite interesting results. We were actually, there was a lot of certainties, what we observed in the previous round 1, we were struck by how how confident people were in terms of what their expectations were about their future economic outlook. So basically in UP, 27% said they would improve in round one, 43% said, likely to get worse, etc., and can't say about 15%. But there was a fairly sharp decline between rounds 1 and 2 in terms of the situation likely to improve. And a similar decline, similar percentage point decline in Odisha as well. So both states, the proportion of households reporting a worsening, reporting a situation where they didn't expect things to improve. I think I should turn it around. Proportion of reporting likely to improve fell dramatically, I think, in some ways. On the other hand, the proportion of household reporting, lack of clarity about what might happen, increased sharply in both states. Now, one can interpret this in many ways, but one way to think about this is increased uncertainty about the future. Whether that's the right interpretation to give to these results, I'm not sure, but that's the first thing that strikes me, at least, that from some people were somewhat more confident the first round one, now sort of watching and waiting, basically. In a situation where the job scenario is changing rapidly and where the economic circumstances are uncertain, one might expect people to move around. And certainly the pictures that we have from March and April and May in India, those dramatic pictures of people moving across country, we asked whether in fact some of that shows up in our survey as well. And what we basically asked a question about whether people return from outside the household in round one and also in round two. And what we see is in both UP and Odisha, between rounds 1 and 2, the proportion of households reporting at least one person return from outside into the household increasing. Not surprising because they're asking about a cumulative number. So we should expect it to increase, but nonetheless, the fact that almost a quarter of the households in UP and almost 10% in Odisha reported somebody coming back is quite significant. That's one observation. The other one is, well, why did they come back? And in UP, the main reason was basically loss of jobs. Some people talked about being near the family and fear of disease. And in Odisha, again, something similar, loss of jobs or the closure of workplace. It's hard to distinguish between workplace closure and loss of jobs because there could be some overlap between the two. But nonetheless, you can see that lost jobs, closure of places of work, education, and so forth were actually major drivers. And UP wanting to be near family could be another factor. It's hard to understand exactly what that variable means. But nonetheless, the other two, the loss of jobs and closure of institutions, sound quite significant and important in this context, in our survey at least. This question was not asked in round 1, but was asked in round 2. Given, and we suspected this because we suspected that people might be returning to work, we also asked a question if there was any out-migration from the household. Did anybody leave the household in the period between round 1 and round 2? And we also asked why they left the household. And you can see that if you look at, well, I guess column number 3, in terms of return to workplace, that column there, you can immediately see that a major reason for among those who returned to work was a major reason for out-migration was return to work. Overall, though, the proportion of people leaving the household was not as large compared to the in-migration. So roughly 5% in both states combined, 8.8% in UP, 1.1% in Odisha. So yes, there was some out-migration, but it was certainly less than the in-migration component. So if more people are coming in than leaving, presumably, although these are dummy variables, you must remember, not numbers of people, and the major reason being return to work. And that again reflects, if you recall, the fact that between rounds 1 and 2, a lot more people had moved back to some kind of work, even if it wasn't as well paying as prior to the epidemic. That's for the effects on household incomes. how they cope with income losses, the migration response. Now we move up to a couple of slides on questions regarding access to healthcare. So in this survey, we asked two sets of questions, basically, first about health status and treatment in the last 6 months, and also the main challenges they might face if they were to fall ill. So this particular slide looks at the household experience or the respondent experience with illness in the last 6 months and treatment response to that. So if you look at the bar chart, well, roughly about, I forget the exact numbers here. I think I have to move this thing around a little bit. About a third of the households reporting at least one member who was sick in the last 6 months. And as you can see, about half of them sought treatment. What are the difficulties cited in seeking, in getting access to this treatment? The most important were getting money, and that shouldn't be surprising because income loss is a major concern in this period. Distance to health facilities to the extent that, well, both for a variety of reasons, risk of disease as well. And of course, again, the third part is also linked to that, ability to obtain transport for that. So these factors are the major drivers, but we asked also a bunch of other questions, and you can see that households responded yes to a number of questions, including finding someone to go with them, et cetera, et cetera. In the next slide, basically the response to a question about if household were to fall ill, what would be most problematic for them in terms of accessing care. And so the red refers to, well, I think let me look at the exact, go down a little bit. So the red refers to a major problem, big problem, the violet a small problem. And you can see that a very large proportion of households characterized, indicated that getting money for treatment, non-availability of healthcare providers, fear of getting infected, finding someone to accompany them, or again, and getting access to transport, all as major or at least some kind of problem. So in that sense, now these problems are significant, and certainly we don't know whether it actually affected people's access to care. We don't have any sort of data which links these factors to actual choice of care and access to care. But nonetheless, I think we can clearly see people citing these as important factors in their choice or their ability to choose or access healthcare in times of COVID. And then you move to education, and we introduced the question in education by first asking people which of these or what are people's concerns about income, health, and education in the time of COVID. And again, as you can see, that basically more than 90% of people reported being very concerned or highly concerned about potential income loss, potential access to healthcare, and access to education. So this is, all three of them were major problems cited by households or the household respondents as something linked to COVID. So we looked at the issue of income, not surprising, given the income losses. We looked at the issue of health. And again, as I said, while you don't have careful sort of statistical data on how these factors, different factors played a role in people's choice of services, at least people are citing them as major bottlenecks or in influencing care. But we can also see that education is a major source of concern for more than 90% of the households. So what do we find in terms of the effects of education? And what we have here are, again, households broken down by type of main occupation prior to COVID. And here again, as before, there are four categories of households: self-employed in agricultural activities, self-employed in non-agriculture activities, casual wage work, and salaried, and of course, all combined. And we have them for UP and Odisha separately. And what do we see here? Just to sort of fix matters, the green part of the bar refers to the proportion of households reporting children having either dropped schooling and or engaged in economic activity. The second refers to not being able to attend for whatever reason, in this case, COVID, of course. And the third one, no effect at all. And what do we see here? That a very large proportion of households report either dropping, they report house children either dropping or engaging in economic activity or not being able to attend. So less than, I would say, yeah, in both samples, less than 60% of households, whether in UP or in Odisha, reported being able, reported no effects on education and attendance. So clearly there are big effects on access to education. Who is particularly badly affected? I think the numbers are pretty clear here. I think mainly people living in, well, the self-employment in agriculture and actually casual wage workers as well. So of course, all categories are affected, but two categories that are particularly badly affected are people living in, I guess, in rural areas, working in agriculture, and people involved in casual wage work, which potentially could even be in agriculture. So again, this is where the effects are, but what's clear is that there have been effects, which is not surprising. Those who live in India know that unless you have access to a smartphone and so forth, you basically are, in many, many cases, going to do without access to education. A final sort of a thought, well, given all these challenges, how are people perceiving government responses to this challenge? And so what we had was a final set of questions on people's responses to regarding questions on perception on government action and perception on the government decision to unlock. One thing is pretty clear, that the decision to unlock, i.e. drop the lockdown, is generally popular. In fact, almost the entire sample, both rounds, basically spoke out in favor of this. The other thing to think about is, well, what are the government perceptions and how did they change? Perceptions of households on government action. What were those in the rounds 1 and 2 in both UP and Odisha? And what we can see, and that whereas there was a degree of confidence in the government being able to perform in round 1, that confidence seems to have tapered off a little bit, both in UP and in Odisha. Certainly, the very confident category has fallen dramatically in both states, and the somewhat confident has gone up, but overall, both categories have seen a decline. So both in terms of intensity of confidence, if you will, and you can see that the proportion of no confidence has increased as well. So in some sense, I think the epidemic has lasted longer over time. I think the enthusiasm for government action and the economic challenges remain, even though certainly in I think there will be a degree of clawback, as it were, on the economic losses. So this is the last slide. But I thought I might just summarize the main ideas. I think in the three, remember the questions were to look at the economic effects, particularly income effects on the household, occupational issues, looking at access to healthcare and access to education. And what we do see, I think, broadly speaking, is still confidence in the government, still increased government support, but what we certainly see also is some tapering off of enthusiasm, some more uncertainty about the future. On the other hand, yes, there is definitely evidence of growth in economic opportunities for households, but those opportunities have not been enough to claw back on the economic losses occurring due to the epidemic. There are certainly, I think, declines in access to education, and at least based on household responses, challenges in terms of accessing healthcare. I'll stop here. This is the very last slide. Thank you very much, and thank you for listening. And thank you again to the team.
Thank you, Ajay. very comprehensive roundup, and I'm sure there's going to be a bunch of questions. But before we open up the Q&A, would Barbara or Sumit Kane like to come in? Or Ghosh? I'm not quite sure how we've organized this. Barbara, Sumit, Ghosh?
Yeah, look, I think if we start to engage over the questions, I think a number of us, I think particularly me, because I know Sumit can't stay for so long, will be able to come in and comment on some things. I just started to go through the Q&As, and certainly I think there are a number of aspects that we can just clear up quite quickly in terms of why we designed things how they
Barbara,
are.
Sumit can actually stay back. He's pushed his next meeting.
Okay, well, I'm
so
sure
he's
Sumit
with
can
us
help
very nicely. He's with us. So
that's great. So I mean, I think just a little bit of background that may help some people with some of the questions that are in there. Just to emphasize that this was a bit of an opportunistic use of a sample that had been collected for other purposes. And therefore, some of the questions about why we sampled how we did can only be answered relative to the original study that we did. So for example, why did we choose these two states? Because the original study is hoping to contrast two states where we believe the health system is quite weak with two states where the health system is believed to be much stronger. And these are two where the health system was believed to be weak that we had collected before COVID has prevented us from getting any further with that main study. So these two states were selected on the basis of being identified as states with rather weak health systems. And in terms of the sample, and I think this is important in terms of interpreting what we have here, or potentially important, it's maybe arguable. The households are all households who have somebody in them with a chronic condition, one of three tracer chronic conditions that we were using in the main survey. Now we're somewhat unclear whether that makes them unrepresentative or whether such a high proportion of households are likely to have chronic conditions that they're probably not significantly unrepresentative of the state as a whole. So let me start by just sort of responding on that, and that may answer a few of the other questions that are around, but maybe I can also hand over to Mr. Ghosh and to Sumit to pick up any other issues that have been raised in the Q&As. Thank you.
Thank you, Barbara. Sumit?
Yeah, maybe I could come in to elaborate a bit on what Barbara has just said. So the 2,000 plus people who were included in the first round and the 65% of those who we went back to and we were able to reach out in the second round, these are all, a large proportion of them had been administered a very
Sumit, could
detailed...
you just get closer to the microphone maybe? Or
yeah, is it better now?
Yes, you're a little faint. Thank you.
Okay, so the people who are part of this round one and round two, a large proportion of them have been administered a very detailed survey, which was part of our study on health and healthcare seeking. So as Ajay was saying, we've got a whole lot of background information that we could build upon, part of what Ajay referred to as round zero. And then we were able to build on this and do round one and round two in that sense. So yeah, very opportunistic, but very useful and helpful, as you can see. Yeah.
Suman Berry is with us. Suman wanted to actually pose a question. So Suman, I think we are able to bring you in. Oops, sorry. Yeah, Suman?
Not to worry, I've been given the option of unmuting. Thank you, Shekhar. I just wanted to note that Sagas Nossal came to NCAER in 2003 to give the second Sir John Crawford lecture on international health advances in a troubled world, with a lot of focus on vaccination. At that time, polio, HIV, AIDS. So I just thought that this was a good moment. I didn't know that there was a school named after Sargas at Melbourne, to note that. And of course, it is a pleasure and a privilege, to see Ajay Mahal, who overlapped with me when I was DG NCAER for a while. He can't see me, but I can see him.
I can certainly hear you.
Okay, great to see you, Ajay. So I don't know whether you were still at NCAER on March 28, 2003, because that's when Sargas came to us. And each one of these Sir John Crawford lectures is a gem, including his. But if I could then, thank you for recognizing me, just ask my more substantive questions. I mean, I think that frankly, this is one of these cases where description is much more important than analysis. But to go back to the old bête noire of NCAER, the income question, particularly at any time in India, income is troublesome. Why did you think that income rather than consumption was the thing to go for? Is it because you were interested in saving? So given what we've just been told about the antecedents of the survey, has there been now some stabilization on what people mean by income in an Indian context? Secondly, I may not have paid the kind of attention I should. Is it easy to pick out landless households amongst the rural households? And as you go forward, does the sample sizes permit you to tease out big differences between urban and rural, which obviously has been a huge issue, both politically and economically in the pandemic? And then finally, on the perceptions of government, was there a question asked? Is there an indirect way of figuring out whether, as it were, the confidence and the political credit would redound to the union government or the central government, or is that too much of a ask? Thanks so much, but fascinating work, and I think you were right to be opportunistic. Back to you, Shekhar.
Thank you, Suman, for coming in. And yes, Suman is my predecessor at NCAER, and thank you for thinking about the Crawford lectures, which we really do appreciate and value a great deal. At some point, I should turn to my Australian friends and see how we can restart the Crawford lectures. But they certainly were very, very, very timely. And when you think back now, quite a few years, but the concerns were there even then, in a different context, not this kind of a pandemic, but certainly other issues. So, Ajay, Sumit, to respond to Suman?
I think I'll leave the question regarding Sir Nossal to Barbara, but I'll certainly, the comment regarding Gus Nossal, but I'll speak about some of the other questions Suman had. I think, given that we had only 15 minutes, and given, it's very hard to figure out what people think of government, whether it's state, local, the panchayat person, at what level.
When you say 15 minutes for the interview, the telephone interview.
The interview and so on. I think it would be very hard to tease out anything of that kind in terms of who gets the credit or doesn't get the credit. I think it's a great idea. It's something worth thinking about in the Indian political economic context. But I've not seen this type of analysis even in other surveys, but that's for one side. I think it's an important question. I think it's worth responding to it perhaps in some other additional follow-up survey. In terms of the income question, Suman, that's a great thought that you put forth. We used to criticize anybody at NCAER for putting in too many questions on income. But the main reason you put in there was, I suppose, because we weren't asking about income levels. We were simply asking what sort of declines in income they observed. Now, you're right, we could have asked about expenditure as well. and perhaps that may be the better variable, but it wasn't obvious to us whether one would be better than the other. It's just because there is some concern that even expenditure numbers can be messed up by depending on who answers the question. So that's basically my somewhat weak response, but I think it's an important issue that needs to be looked at. I just don't think we would have been in a position to look at this thing in more detail, anything beyond what we could do. Now, there was one other query you had raised, Suman. I'm not sure what it was. Do you recall, Sumit, what that was?
Landless.
Yes. Now, I don't know if we had a question on land. Prabir, did we have a question on land holding and so forth and assets?
No, we don't have any questions on that.
So I think the closest proxy we have, Suman, would be somebody who's living in a rural area and is a casual worker. I think that's the closest we can have to proxy to that question. And maybe we should look at it because the sample, I don't think is that small for casual workers. So we can look at it.
If Shekhar would just give me the liberty, since I'm still allowed to unmute myself. Look, what I had in mind was the analogy with China. Everybody, people say that in China, the social safety net, because of the way in which land is held, etc., is that everybody working in the cities has an association with a patch of land. Okay, so they have a place to go back to. I don't believe that you can say that about land as an asset, land as a productive source. I don't think you can say that in the Indian context. And therefore, the question of whether coping mechanisms are fundamentally different for those who have access to land and not have access to land, that's where I was coming from. Thanks.
I sort of think we're seeing it in the data, actually. I mean, maybe I haven't got it right, but Suman, I was thinking, and this is for everybody, I guess, and people, it's what we are seeing in the data is people moving from urban areas to rural settings, then staying on. And to me, self-employment agriculture, what is it? It can't be anything else but working on some sort of land, even if it's 1 biga. So in some sense, some of that is definitely going on. And that's why you see in the data that the people who become really who suffer the most are the casual workers. So in that sense, I think this is broadly consistent with your idea that in fact, access to land can be quite protective. Now, it may not exist to the same extent as in China, but certainly I think this data is not inconsistent with the broad hypothesis that land is a source of support for a lot of people who may have been affected by the epidemic.
Thank you, Ajay. Barbara, do you want to comment on Sir Gustav Nossal? And he is obviously your best-known immunologist globally, one of the leading lights, and you
Absolutely.
are privileged to, of course, be named after him. Barbara?
Absolutely, and he's still going very strong, approaching 90 years old, I think. And it doesn't surprise me at all to learn that, given a title like that, he talked about vaccination, because whatever title you give him, he talks about vaccination. So it's good that it comes back at a moment when vaccination probably is the pressing issue of the moment. But no, he's a wonderful name giver to our institute, and we're very proud to have that name and very pleased to be associated with him. So thanks.
Yeah. There are a bunch of other questions, and I think, Barbara, you wanted to answer a few of them live. I think you've gone through one or two of them, the sampling strategy, I guess, and the rationale behind the choice of the two states. Others want to pick up on, there's a good question from Mosmi Das at NCER. Any scope for including in future rounds of the survey and other surveys conducted a separate category for health workers, especially rural health workers whose employment status may overlap with other categories? Would be useful given the big rural-urban divide as to how rural health delivery is happening.
Sumit, any crack at this? Barbara?
Yes.
Look, I think we're very constrained in what we can do by the initial data set that we constructed. Among the occupations, you can see that the salaried are relatively small numbers, and I assume among them, the health workers, quite a small proportion of those. So being able to say anything very much about a single occupation category, I agree it would be extremely interesting to be able to do that. But actually, when Ajay was presenting, I realized I didn't understand, probably should do, where the additional 600 people that we didn't include in these results had come from, and whether that suggests that we might therefore have the opportunity to do some strategic things in terms of adding people in as we lose people from the panel. Don't know if anybody can comment on that from among my own team.
I think it's certainly possible.
Yeah, so we could think about it. Yeah, so a nice idea. Thank you.
Question about gender differences. We inevitably need to and want to discuss this question. Ajay or Sumit or Barbara?
Let me have a look at the question.
Were there gender differences in the responses overall and between the states from Vivek Padvetnaya?
A great question. I deleted the slide on gender responses just before the presentation.
Oh,
Why?
Why did you do that?
Because when I was discussing with Ghosh prior to this talk, we were thinking about perhaps we should look at female-headed households versus male, and to see if there are particular challenges that they face. And then I realized that we actually didn't have information on female-headed households. Instead, we had respondents. One could, of course, infer that a respondent could potentially be a head because they would probably be somebody powerful within the household. But to answer your question, is that Vivek that asked the question?
Yes.
Yes. We didn't. I mean, my slide didn't show any difference between male and female respondents, and that was disappointing to me. That's why it's not there, by the way. So, but there were no differences. Absolutely right. Thank you for asking that question.
And it's probably not surprising because it is just the respondents. Sometimes they changed from one round to the other. So I think there might be questionable, well, certainly interpreting what we're getting when we're looking at the gender of the respondent is pretty hard to do. We probably should have asked about female-headed households, but it's an opportunity missed. Maybe we can ask next round.
But I tried to analyze by gender. Gender here means the respondent, the male respondent and female respondent, not female-headed household or male-headed households. So in few variables, I saw that there is hardly any differences between the two. For example, there is in reduction in income. So we'll hardly get any differences, the responses between male and female. So that's why we dropped this variable. Actually, if it would be the female-headed household, then we might get some differences in the answer, but it's not respondent. It's only the respondent actually.
Shekhar, would you mind if I ask one question of Ghosh, actually, my team member?
Absolutely. No, this is part of the plan.
In our baseline, we must have had a question on head of household, right?
Yes.
And that must have women versus men. So in theory, Vivek, we can look at it. Let's go back and do some homework. And if we find something, we'll get back to you.
Okay. Vivek says that's great. Maybe we could spend a little time on, you said next round. What are the future plans for either returning back to the main study, health-seeking behavior in 4 Indian states, or doing further rounds of the telephone survey? And in a sense, you did a survey early on when we were really in the thick of the lockdown still. And then you've done one in October when we had possibly passed the peak, I think, nationally of the infection rate, the weekly sort of average infection rate. So differences in perceptions overall that you see between the two, I think there was a question on that as well. Anybody to answer that?
Well, I think there are some really interesting questions posed by the data rather than answers provided. And in particular, that Odisha seems to have recovered less than UP in a number of important respects, particularly around the economic variables. And I would be very interested if others who know the two states well could offer any explanations of why that might be. So yeah, that was one thing. I think there was also something rather interesting about the attitudes to government. Yes, everybody approved of releasing the lockdown, but interestingly, the approval levels were higher when the lockdown was on than after it had been released. So again, I wonder, is that just people are pleased that the lockdown's over, but there are other things that government's doing that are likely to lead them to say some less complimentary things about government, or how would we interpret that? I'd hope that we might get some thoughts from our audience, perhaps, maybe even if they can only type things into the Q&A box about what they think might be going on, or if they would like to email us or get in touch with us with potential to explain that. I think that would be really, really great.
Yeah, that would be excellent. And in terms of future plans for another round of this work, or maybe going back to the main study when field conditions permit, which may happen in the next few months?
Yes, I think we're all waiting to hear how successful the Indian vaccine turns out to be, given that's what's circulating, isn't it? Yeah, no, I think what ideally we would like to get back to our field work and do the other two states that I mentioned, the two states with we believe will have better health systems. So that's Maharashtra and
Tamil Nadu.
Tamil Nadu, yeah.
But I would like to see a third telephone survey round done if we can muster the resources to do it. I must say, I think it's pretty fascinating how these answers are evolving over time, much more interesting, in fact, than just the one slice of data that we got initially.
It'd be very useful to actually do that, and certainly from NCER's point of view, very productive, because we are learning so much about not just how people are responding and have responded and how they think about the kinds of perceptions you're asking questions about, but I think it's just teaching us so much about telephone surveys, which haven't been very common outside the marketing kind of firms and the pure commercial. But for scientific research, there's just been not a great tradition of telephone surveys in our country, in India. And unlike, say, the US or other advanced countries, certainly everything is done telephonically. So this is, with the penetration of cell phones in particular, I think this is an important innovation that we should all be pushing harder on. In other parts of NCR, we're doing exactly the same thing. In fact, just earlier this week, we had the Delhi NCER, the National Capital Region Coronavirus Telephone Survey, and that was in its 4th round now. So certainly encourage Ajay and Sumit and Barbara and Ghosh to think about a next round on this. Will there be a report? Will there be a kind of a write-up of this? Certainly we can share the presentation. I think Vivek was asking that question. So Vivek certainly will have the PowerPoint up on NCR's website today, so you can download that. But are there plans to write up the surveys in a more comprehensive document?
Yes, we had explored with a number of journals their interest in the paper and at the first iteration, and we got the response that there was a great deal more interest in the panel as more iterations emerged than there was in just the description of the initial situation back in June. So our intention is an academic paper from this in a journal, but whether we want a third round before we go for that, or whether we think we can place a second round, a 2-round paper in a good enough place. We didn't want to sort of spoil the pitch for the best place by publishing too much too early. But we certainly intend to get it published in the longer run. And if people would like to tell us that, they'd like to know when that happens, and we can certainly alert them and probably share pre-pub versions and so on.
Okay. Another question from Anushka Kalita, which is, did you see any changes in the factors impeding access to healthcare from your first and your second round? Was there any marked difference in terms of access to healthcare?
Don't recall offhand. Ghosh, do you have any?
Yes, sir. There is a change in the like for example, earlier the public transport system was totally disrupted. Now the people have reported that though the public transport system is available, but for healthcare, those who are getting seriously ill and want a public vehicle, so they have to pay. They had to pay 3 times, 4 times. So that's one problem was there, and the other problem, they are still highlighting the finances for treatment are also out of the each one of the main obstacles for not getting treatment. So earlier around 30% households, around 30-35% households reported. Now the proportion of households reported finances for treatment is less as compared to the round 1. So still there, but it's going down. The reporting is going down, but still is there. Still, these obstacles are a serious concern.
So that would be consistent with the idea that the economic situation is improving, but has not improved to the point where everything is hunky-dory, basically.
Can I ask another question?
And that's why one of the main findings when I talked to our investigators after the survey work, with most of the investigators I talked, and if they have any feedback in the field, so they were telling the 2 things they are telling. The most of the investigators were told during interview by the respondents, please ask government to provide some cash incentives. So around more than 80% households, they are getting the social safety nets in terms of grains. And in Odisha, also few households reported that they have also got some cash incentive. But in UP, this is very less. And because they explained also, so if we get some cash incentive, that then it would be easy for us to buy some necessary items of our daily needs, and medicine is one of them. So in that way they are suffering. So one of the question Mr. Raju put here, that NBFCs and microfinance. So yes, definitely in UP it would be needed because you have seen that around in our sample around 30% households belong to the self-employed non-agriculture. And mostly they have lost their micro businesses, and whatever saving they had, and they have spent on their daily needs. So to revive their business, so they may be needed actually. So these are the few issues that local government can think over it actually.
I had a general question which came up earlier in the week when we were discussing the Delhi National Capital Region survey, and this was the sense that as other data have shown us, there's been a pickup in jobs but not a pickup in incomes. So that effectively wages have probably declined and people are willing to work for much less. Do you see any of this in your survey?
I think this, what we see in the data very clearly, if you look at it in one of the slides, I forget which slide it was, that yes, people have returned to work, but the proportion of people reporting a decline in income of some kind, that still remains. It may have improved a little bit compared to June, the June round of the survey, but the declines are still there. So people still have, whatever it is they're doing, that could be some combination of job shift, so you go for lower paid jobs, or you do the same job at a lower wage. So both are possible. I think it's something worth investigating more carefully, but I don't think we had that sort of detailed information by job. But we do know that people have gone back to work, but they're still reporting income losses, and that's clear from the survey.
Yes, and I think for the self-employed, it probably just means that the businesses are less successful, whatever kind of businesses they are, whether, you know, even if you go for kind of rickshaw drivers or whatever, you know, they're likely to, people were moving around less, they're likely to find less rides, through to people who are running cafes or whatever. People are probably going out less and drinking fewer cups of tea. People whose workplaces are still closed will not be out using all these services. So I think it makes sense that whether you're paying your employees and you're based in your resources for paying them are based on these kinds of income streams, or whether you are a self-employed person, that these are likely to be the impacts. But you know, as Ajay says, we don't have the data broken down beyond employment category. So, but I think we can see that, for example, casual workers and self-employed had much higher income losses, or a much higher proportion of people reporting income losses than the salaried. So people who work for a formal salary are still being paid the same salary, most of them. And it's all those people who are either casually employed and getting fewer jobs, directly employed in small businesses that are less successful, or self-employed that are really still suffering, I think.
Yeah, and if I may add to Barbara's point, I think the fact of the matter is the salaries in India are also paid in informal sector companies. So the notion of salary itself is not necessarily linked to formal. It could be formal or informal sector salary. That's one issue. And the other one is, I mean, if you want to dig a little bit deeper than what we did, one could look at what the person was doing before COVID, at least the occupation category, and look at the same person if they did the same thing and reported a loss in income. I think one could do that. We haven't done that. We looked at the entire category at the baseline, but we could take this inquiry a bit further by seeing what happens to the same people who do the same occupation later on as well. So we can actually, if you will, decompose the data in those people who shifted jobs versus those people who remain in a similar category of job, and see what proportion of income, well, in this very categorical way, what proportion of this decline came from the shifting part, and what proportion came from the, so without being, of course, being a purist about it. We could do that.
You know, we may not have done it yet, and but our findings definitely point to something really clearly stands out. I mean, we've all talked about the long COVID, right? People getting symptoms that carry on for a long time and troubles that carry on for a long time. I think there are many other dimensions of long COVID that our data is pointing towards. Loss of income, reduction, stepping down in terms of the jobs that people have been doing, kids dropping out of school, not being able to carry on with their studies. All these are long-term consequences that our data is pointing towards. And it's a expanded view of what the long-term consequences of COVID are likely to be. And as Shekhar, you were saying, if we do another round as we intend to, I think more of this will be revealed, and yeah, it should be very useful.
Yeah, it should be very interesting. A couple of, we're almost getting close to the end of our session, but I thought take a few questions more. Two questions from Mohsin Kazmi. First, a methodological question about, and Ghosh, you may be the best able to answer this. What are the challenges faced during a longitudinal telephonic survey? Some seem very obvious, but I'm sure there are lots of hidden problems that one confronts doing this. And then also from Mohsen was also the question of who were more vulnerable in terms of age and income. We've kind of answered that question a little bit, but the age question might be worth taking up if you have information on that. Ghosh, on the challenges in telephone surveys, especially panel surveys?
Challenges on telephone survey only in one aspect, not other aspects. Why I'm saying only in one aspect, in round one, we interviewed around 2,068 households. And in round two, while we tried to get back those households, we could get only 65% of them. So another 35% was the attrition rate, and that out of that, those 35%, so network problem was there, big network problem for remote areas. And some people, what they generally do, they get the cheap SIM card and they change their phone numbers. So that is another problem. That was another problem. And the third problem was that the many households could not recharge their existing phone, and incoming call was not available. So these are the challenges why we could not contact all the households. But if you do physically, then I think for longitudinal study, for panel study, there will be no problem.
I wonder if this creates the room or an opportunity to discuss with the telephone companies, because they obviously know who their subscribers are. And if a consent can be obtained on SMS to their subscribers, and you might kind of work with them with anonymized lists so that you could stratify your sample, and then they could push out SMSs for you seeking consent. And if that's obtained, then that might be a way for us to substantially expand the pool of potential respondents, and with stratification. Again, maintaining anonymity all the way to the point where they give you consent, after which then, of course, you are able to talk to them on the phone. So this may be something we're certainly discussing with Facebook, the idea of, just as University of Maryland and Carnegie Mellon and then MIT both have now Facebook surveys that they are doing. We've certainly started using that data. We've talked to Facebook also, since India is Facebook's numerically largest market, that this might be something that might be possible. But certainly on the telephone, talking to Jio and talking to Airtel and talking to Vodafone and BSNL and others about the possibility of doing this so that confidentiality and privacy is not breached, because the telephone company clearly knows who the subscriber is. Legally, they are required to do so. And if that can open the doors to those who wish to participate, this might be a very interesting development for us to think about. Anybody on this from the team?
Yeah, I think I was just thinking, when you were talking about for how long telephone surveys have been one of the main mechanisms for doing surveys in other countries, and I'm sure cell phone ownership is higher now than landline ownership was at the beginning of that trend in a country like the US. So I see no reason for not doing it. I guess one issue that Ghosh touched on that is probably underlines the distinction between doing it with cell phones now and landlines then is the tendency of people to lose their money, lose their numbers, move on, change their phone in a way that landlines would have been much more consistently reliable, I would guess. But also, I think the issue of relying on people opting in, whether it's on Facebook or from SMS numbers that a phone company might send out, is that would be very difficult to work out what biases that had introduced in the sample. So I think one thing that we've really got in this sample is we really know who they are. They came from a line listing, and so we know exactly how their characteristics compare with the characteristics of the whole populations in the villages that we entered. Of course, we don't know the broader set, so there still are some of those issues. But I think over time we might learn more about what is the bias of, who are the people who opt in. But I'd be surprised if they weren't quite important biases. I can't see the average agricultural casual labourer opting into doing surveys from an SMS. Maybe that's not.
Maybe Ajay wants to come in, but I want to raise the question then of incentives, because certainly in many parts of the world they're very common, and the Indian survey community, at least the non-profit scientific survey community, has stayed away from incentives, and they can be very modest. But I've certainly encouraged our own Data Innovation Center to pilot identical questionnaires with incentives and without incentives, and actually see what biases, if any, come into play and what that does to our response rate. Because at some level, as economists, we are essentially going with the notion that the opportunity cost of time is zero for our respondents, which is always never the case, of course. Ajay, you wanted to come in on this idea of...
Yeah, first of all, I understand the government of India has a bill on this sort of, on data, whether it's non-personal or personal, which is stuck somewhere in Parliament, and I'm wondering how this links to that sort of, that particular bill. But I think, I want to have sort of support Barbara, and the thing is, the fact that we did this survey, we were able to get a lot of information, which is going to be awfully hard to get through an SMS type format. I'd be very surprised. Of course, I could be proved,
No, Ajay, I didn't mean. Yeah. Sorry, I didn't mean that the survey itself would be done on SMS. Just the consent would be obtained on SMS, and then you would call with your regular telephone survey. It's breaking through in some sense the population. You have clearly just a survey, a sample from your existing work. You're lucky. And so did the Delhi NCAER coronavirus telephone survey. They had an existing survey. But it's the inability to have a large collection of telephone numbers that are valid. That's the problem. All right. I think we are almost getting to the end of this. So one last question, which again seems to have been triggered by the discussion we are having. How much data for telephone survey is as reliable compared to a face-to-face survey? That's sort of comparing the gold standard with everything else. So I'm sure the data are reliable as can be, but you don't see the body language, you don't see the person's circumstances, you don't see how they are multitasking, and at some point they're just trying to get rid of you. That's a little harder to do when you are sitting across them at their household or residence. A telephone is easier to do that. So I'm sure there are lots of issues in telephone surveys, but I think it's still incredible that you pivoted so quickly to doing this survey, and clearly we are better off having done this than simply put our field surveys in suspension. Okay, we are at the end, so I want to just ask our team if they have any final thoughts they want to share with our audience, and if so, please, this is the moment. Otherwise, we'll close out the session for today. Barbara?
Just to say, just please do. I'm very conscious of the Zoom webinar format is not terribly friendly to enabling us to really communicate with each other. Please do get in touch, and I'm sure our email addresses can be shared if they haven't already, and let us know if there are things that you could help us with in terms of some of the interpretations that we're querying. And I just mentioned a couple, but I think there are a whole lot of things that we have questions about how to interpret, and also any other questions that you've got or just let us know that you would like to know when there's a public notice.
Would it be okay to share your email IDs with everybody in the chat so that, yes, okay. So let's do that, Iman, if we can. Can you just share them on chat so everybody sees them? They're, of course, on the Nossal Institute's website, so you can also find them there. Ajay?
I don't think we're hard to find, but anyway, just since this will probably be my last word, just to thank very much everybody for coming and to mention how much we appreciate our collaboration with the NCAER. It's always a joy to engage with you all. Thank you very much.
Thank you, Barbara, and likewise here from NCR. Ajay?
I just want to thank the audience. In fact, I thought that there were a whole range of very interesting questions, methodological ones that were raised today. I can think of quite a few, so I don't want to sort of list them one by one. But I think those are questions that are certainly important and worth engaging in the context of telephone surveys, in fact, surveys generally. So thank you very much.
Sumit?
I would also like to thank the audience for their critical comments and for listening to us. I really appreciate it. Thank you so much.
Ghosh? Oh, you're muted. Sorry.
No, I'm not muted.
Now you are not.
Okay. So thanks to the audience and for presence, and hopefully we can move for third round and focusing especially on health issues and education issues. So let's try.
Great. Thank you. Thank you, Barbara. Thank you, Ajay, Sumit, Ghosh, Nossal Institute. I also should take the opportunity to thank the Bill and Melinda Gates Foundation for their support for this work. It's not exactly by accident that a lot of our survey work, and particularly the pandemic-related work, is being supported by the Gates Foundation, and we are very grateful for this very timely and very understanding support, which has allowed us to repurpose existing work to respond to the crisis that our countries have been going through. So with that, let me thank all our attendees. You've been very patient. Suman, thank you for joining and for reminding us of the connection with Sir Nossal. It's really wonderful of you to have remembered that. And I want to wish everybody in Australia good afternoon, and here in India, as we head towards lunchtime, a good morning, and thank you all for joining. All the best, everybody. Stay safe, and we'll be back in touch again on our next webinar. Bye-bye.
Thank you.
Bye-bye. Thank you.